Dr. Comen. As a medical oncologist, you often lead a woman's healthcare journey. How do you envision your role evolving in an integrated survivorship model where emotional, aesthetic, and mental health recovery are treated as part of breast cancer care, not just afterthoughts?
So I feel a little bit like a politician. You asked me a question, but I'm going to answer something totally differently for a second. I was sitting here listening to all these amazing physicians speak, and of course, Allison and Roberto, and it made me think of the Maya Angelou quote, "There is no greater agony than bearing an untold story inside of you." And for so many of us as patients, but as clinicians, we are part of this sacred journey of listening to the struggles that patients face. And for me, I think there's maybe I'm a little bit biased, but no greater disease that throws into high relief the existential questions of what it means to be alive, what it means to survive, what it means to thrive in our bodies. And so much of these stories, not just for myself, but from my patients, have pushed me to this work. I'm the new kid on the block at NYU. And so with that, I just wanted to thank everybody here for having me. And Allison, I feel like I'm of this duo, the more sappy one. But for so long, I felt like this work that I really felt so passionate about was really a whisper behind a glass door, a glass ceiling, all the things. And I didn't know if anybody would care. And then NYU obviously recruited me, and I have been so grateful. But you have combined such passion, such purpose, such vision in creating this extraordinary collaborative and endeavor. You are the definition of main character energy and everything in between. You've shattered ceilings, walls, all the glass, and done it with such sparkle and dazzle, and it's a joy to collaborate with you. So thank you for all of that. And I think that in part answers your question about, two women can have the same diagnosis of breast cancer and it looks the same underneath the microscope and all the things. But what makes my job, I feel, so special is really getting to know women, what they care about, what matters to them, because it isn't just about surviving your cancer or whatever it may be that brings you to a center like this that you want to live better and prevent disease, but what it means for you to actually be alive. And that's so unique to every patient that we see, and I think is often dismissed and invalidated in the fragmented care that women have experienced for so long.
For sure. So you're also co-medical director of the center. If a woman told you that she survived cancer but didn't recognize herself, what are the NYU services, referrals, and support systems that you would share with her?
Well, that's one of the things I hear so often. I mean, when we think about a cancer diagnosis, particularly for breast cancer patients, it really cuts, as I know you're going to talk about soon, so many of what it means to us to feel like a woman. Even the hair loss, there are so many women that will say to me, okay, the first question is, am I going to die? And then, am I going to lose my hair? And they're so embarrassed to ask that question. And these topics of what we presume is vanity are often shamed in circles of medical communities. I remember I had a very famous oncologist that I worked with who was bald, and he would say, I'm bald, why should it matter to you? But it mattered to these women, so many women. And now we have things like cold capping that we can offer. But in terms of what it means to look at yourself when you are going through something traumatic and when you've been through something traumatic, it's so important that we address. Some women may not care what their breasts look like, what their hair looks like, but some will. I had a patient who came to me from Chicago. She had metastatic breast cancer, which means that she's not going to survive her cancer, but is going to live with it. And she had the best medical care. I was thinking, this woman, there's no evidence of disease on her scans. Like, why is she seeing me? And it was one of those moments where we talk with her and I'm about to leave, and it was classic, and my hand is on the door. And she said, I really came here for one question that I didn't ask you. And I said, well, what is it? You're doing great. And she said, I'm afraid to ask my doctor if I can get Botox. And I feel like I should be so grateful to be alive. And I feel like I could come all the way to New York from Chicago to ask you this. And I was like, well, I love my Botox too. So you can, and we can hook you up with a doctor that will give you your filler and give you your Botox and with all the lasers that you want. We'll make sure it's safe with the treatment that you're getting. And I think that's what it means to actually be a physician. So many of us are kind of stuck in these ivory towers and we're not meeting women where they're at. And that's what's so incredible about the collaborative, and having incredible plastic surgeons who can also really tend to the needs that women have and offer them the space to have the kind of conversations so that they can feel good in their bodies.
That's incredible. That actually leads into my next question for Dr. Weichman. So, reconstruction isn't just about restoring anatomy, it's also about rebuilding confidence. How does NYU Langone's integrative, patient focused model help create continuity for women after surgery, especially after they learn to re engage with their bodies and scars?
Thank you so much for that question. I think a lot of what Elizabeth has already said sort of segues into this, but as a plastic surgeon, we see patients from a point of view of reconstructing and rebuilding, and that is a long-term relationship and develops over time. And I think identifying factors that can contribute to their quality of life is the most important aspect of my job. And because I have such continuity with them, I'm able to identify problems more easily and available to me than other providers along this journey. And I think the use of, especially here at NYU, we're working with using patient-reported outcome tools, because sometimes it's really hard for patients to bring this up, as Elizabeth pointed out, and you need sort of a tool to help them. So filling out a questionnaire can help me identify that, oh my gosh, they're struggling with their sexual well-being, they're struggling with their physical well-being, and how can I address that? And I can see that over time. So using these tools to sort of in visits helps me directly communicate with the patients and identify things that need to be addressed over time. So that is one of the things. And then also just speaking with them and understanding that this is a process and it requires a lot of time, especially with breast reconstruction. It is a journey and takes over a year sometimes, and it is and understanding that and meeting them where they are along that journey. There are ups, there are downs, there are a lot of things that happen, and their perspective changes over time, and I'm able to sort of see that and help them through that.
Do you find that sometimes your patients are uncertain about reconstruction and perhaps feel undeserving of such care? And if so, how do you help them navigate the tension between survival and self-image?
That's a really good question. I haven't had the problem with patients feeling like they don't deserve reconstruction. I think the challenges of balancing a busy life as a mom, as a friend, as a working woman is really hard, and fitting it into the reconstruction journey into that is sometimes difficult. I do think it changes over time as well. Sitting in the first conversations I have with patients, it's often about, I just want to live, I just want to be there for my kids, I just want to get through this. But over time that changes, and I think being there through that time, it helps sort of get patients through that.
Incredible. So my last question is for both doctors. Can you both share a case where these best-in-class integrated services made a meaningful impact on a patient's emotional or physical recovery, and what this comprehensive model teaches us about what's possible in patient care?
I don't know that I have one case. I mean, I told you about the Botox and our metastatic woman. I think it's every patient that I see. I mean, I was very fortunate to train at a cancer hospital and really built much of my career there. But part of the problem was if you had a sports injury, you had to go across the street. If you had a heart attack or a heart problem, you had to go across the street. Being able to practice and take care of cancer patients where no matter what their other medical problems are, you can address them, whether it be cosmetic, whether it be aesthetic, whether it be frozen shoulder from estrogen deprivation, which 2/3 of our breast cancer patients experience. I see this with every patient, and being able to access it immediately in terms of the care that I can offer is really extraordinary. And I think that's what this collaborative is all about, not just for cancer patients, but really being able to meet patients where they're at. And I think what's incredible about that additional services that we're going to provide is, I know we have a lot of people from the media here, and a lot of times there's a disconnect, I think, between academic medicine and some of the media that women are engaging in, because we want that quote unquote wellness. We want to know what supplements. I mean, I'm guilty of buying stuff on Instagram in the middle of the night. I'm like, that creatine is going to make me look amazing, right? But then they're afraid to ask their doctor because they're like, oh, I just bought this thing in the middle of the night. They're going to think I'm an idiot. But really, we'll be able to have those services here and say, look, you don't have to be embarrassed. We can marry what you're seeing on Instagram with trained professionals who can actually tell you this may benefit you and this is just going to be expensive urine. Buy the bag instead.
I have a recent patient who is a BRCA patient who underwent prophylactic mastectomy and immediate reconstruction. And she just mentioned to me that the NYU system, she's had care. She's young, she's in her 30s, and she's had care in other health systems, but that at NYU, she felt all the doctors really spoke with each other all the time. And she was like, everyone knew what was going on because she was dealing with fertility preservation at that time, as well as undergoing her surgery. And having everyone in communication all the time, collaborating, she just was like, it was incredible. And it made the experience so much easier. And it was really hard. And having that made me feel so much better. So I think that is what NYU can offer and continues to offer.